Have you started preparing for USMLE Step 2 CK and feel overwhelmed by all the advice online? One person says, do UWorld twice. Another says, use AMBOSS. Someone else tells you to complete every resource available. And before you know it, you're spending more time planning your preparation than actually studying. If you're an international medical graduate and you're wondering exactly how to study for Step 2 CK in 2026, this video is for you. Today, we're going to cover the complete Step 2 CK preparation strategy, including the best resources, how to build a study plan, when to take NBMEs, common mistakes to avoid, and what actually matters if you're aiming for a competitive score. Let's get started. Ever since Step 1 became pass-fail, Step 2 CK has become one of the most important objective measures in your residency application. Program directors can no longer compare applicants using Step 1 scores, so many of them place significant weight on Step 2 CK performance. For IMGs, a strong Step 2 score can help compensate for many weaknesses in an application and demonstrate academic readiness for residency training. That doesn't mean you need a 260 to match, but it does mean that Step 2 deserves serious preparation and should not be treated as just another exam after Step 1. The good news? Unlike Step 1, Step 2 CK is highly question-based, and if you use the right strategy, your preparation can be much more efficient. Before discussing resources, let's understand what Step 2 CK actually tests. This exam focuses on clinical knowledge and patient management. You'll see scenarios involving internal medicine, surgery, pediatrics, psychiatry, obstetrics and gynecology, emergency medicine, ethics, quality improvement, and biostatistics. The exam contains approximately 318 questions divided into 8 blocks. What makes Step 2 challenging isn't necessarily memorization. It's clinical reasoning. The exam wants to know whether you can make good decisions when presented with a patient scenario. That's why simply reading books isn't enough. You need to train your thinking process through practice questions. Let's talk about resources, because this is where many students get lost. If you remember only one thing from this video, remember this. You do not need 10 resources. You need a few resources used well. Number 1 is UWorld. UWorld remains the gold standard for Step 2 CK preparation. Many students make the mistake of treating UWorld as a question bank. In reality, it's also a learning tool. Read explanations carefully, understand why answers are correct and why the other choices are wrong. Number 2 is the NBME self-assessments. These are the closest indicators of your actual exam readiness. Don't wait until the last month to start using them. Number 3 is CMS forms. These are often overlooked but are extremely valuable for strengthening individual subjects and getting familiar with NBME-style thinking. Number 4 is the free 120. Think of this as your final rehearsal before exam day. Optional resources include AMBOSS, Divine Intervention podcasts, and Anki. But remember, these should supplement your preparation, not replace UWorld. One of the biggest mistakes IMGs make is collecting resources instead of mastering them. Now let's discuss how to actually organize your preparation. I like dividing Step 2 preparation into 3 phases. Phase 1 is foundation building. During this phase, your goal is learning. Focus on completing your first pass of UWorld and understanding concepts. Don't obsess over percentages. Use tutor mode if you're still building knowledge. Phase 2 is consolidation. This is where you start identifying weak areas, review incorrect questions, use CMS forms, strengthen topics that repeatedly cause problems. You should also begin taking NBMEs periodically. Phase 3 is your dedicated period. Now everything becomes exam-focused. Switch to timed blocks. Take self-assessments regularly. Simulate exam conditions. Analyze mistakes and make targeted improvements. A simple study day might look like this: 2 to 3 UWorld blocks, detailed review of explanations, 1 hour reviewing weak concepts, and short review sessions using notes, flashcards, or Anki. Consistency matters far more than studying 14 hours a day for 1 week and then burning out. But let's talk specifically about UWorld, because this is where scores are made. Many students rush through questions, trying to complete the bank. That's a mistake. Quality review is more important than quantity. When reviewing a question, ask yourself 3 things. Why was the correct answer correct? Why was my answer wrong? And what clue in the vignette should have led me to the correct diagnosis or management step? Another common question is whether you should do random blocks or system-based blocks. Early in preparation, system-based blocks can help build understanding. Later, random timed blocks are better because they simulate the real exam. And yes, many students benefit from a second pass of UWorld. However, don't blindly repeat questions. Focus on understanding concepts rather than memorizing answers. Common mistakes that lower scores. Now, let's discuss some common mistakes. The first is resource overload. If you're using UWorld, Amboss, multiple textbooks, 5 YouTube channels, and several note systems simultaneously, you're probably spreading yourself too thin. The second mistake is delaying NBMEs. Some students wait until the final weeks before taking an assessment. By then, they have little time to fix weaknesses. The third mistake is ignoring biostatistics and ethics. These questions may seem small in number, but they can significantly affect your score. The fourth mistake is focusing only on memorization. Step 2 rewards clinical reasoning and decision-making. The fifth mistake is scheduling the exam based on a calendar rather than readiness. Your NBME performance should help determine when you're ready, not a date you randomly picked 6 months ago. Before we finish, here's the advice I would give every IMG preparing for Step 2 CK. Keep your preparation simple. Master UWorld. Use NBMEs strategically, review your mistakes honestly, focus on consistency, and don't compare your journey to someone else's. Every year, IMGs with average backgrounds achieve excellent Step 2 scores because they stay disciplined and follow a structured plan. Remember, Step 2 CK is not a test of how many resources you own. It's a test of how well you understand clinical medicine and apply it under pressure. If you can develop that skill, you're already moving in the right direction. Thanks for listening to American Academy of Research and Academic.